Welcome to the STARS program, seniors taking active roles in society. And now, here's your host, ANITA FINLEY.
Dr. MAMMEN Zachariah, who is a cardiologist and internal medical physician at Broward Health Imperial Point. You know, Dr. Zachariah, I'm glad you're here this morning, and I love the people at Imperial Point. They are the staff, the people there. It's a different kind of a hospital. Somehow, people are very friendly, whether it's the person, the janitor walking by, or the people in the cafeteria, or even the physicians. Everyone has a smile on their face, and they just seem to like what they're doing.
That is so true, and I feel the same.
And then you know that because you've certainly worked at a lot of hospitals in your career. I know that. And this is interesting because when I first met your brother, Dr. Zachariah, and then there's another person, Zachariah, that is your brother, correct?
Yes.
Right. Your brother. And I was thinking about what your father must have thought of to have both his sons being cardiologists. Was that all planned out when you were young boys?
No, my father was a pastor, and my mother was the dean of the Faculty of Education before she retired. And so we would go to the hospitals, being my father a pastor, to pray upon the patients. And so I used to visit when I was an 8th or 9th grader back in India. And we saw the patients, and they're getting the care from the medical community, as well as my father's prayer, being a pastor for those patients. So that is how I got interested into serving the people. So that was our main concern, and so we wanted to go into medicine.
Your brother must have felt the same way?
Yeah, in fact, the same way. We just wanted to serve the people, and my father being a pastor, serving the people in our country. We thought we will do one of those same things, and instead of being a pastor, we chose to become a physician.
Right. Well, we have one pastor in the family's enough. Now we need a couple of physicians. That was a smart thing to do. And what I'm very excited about, of course, is your wife, who is so beautiful, and she also is a physician, which is amazing. I mean, did you plan that?
No, when I was in my final year of medical school and I came home, my mother approached me and said, there is a brilliant girl there, of marriageable age. Would you consider? And then, and then the next thing I know is that she goes into medical school, and finally we get married. When I was in my final year and she was in her first year of medical school, that's when we got married.
Well, that is a beautiful story. So now at least you can. When you're sitting around the dinner table at night, you can say, okay, we've had enough today. Let's just talk about something else, right? But I want to get into something really important. We know that cardiology, especially in the older adults, is one of the key issues with people with high blood pressure and other kinds of issues. And I thought maybe I heard your lecture at Imperial Point, and it was really brilliant. And I thought that we ought to go over. Our listeners are now waiting to hear what is it that they can do so that their heart stays as healthy as possible as they age.
The most important thing would be to do preventive medicine. If you have a family history of coronary artery disease, high blood pressure, or diabetes, those are the three main family histories that would be necessary to make someone realize that their risk of having heart disease, either high blood pressure or cholesterol being built up or having coronary artery disease, more than likely. Those are the patients, when they begin to be about 30, 40 years of age, meet with their primary care physician and have their profiles looked at, meaning they will look at the blood pressure, look at the cholesterol, the sugar level, and those will let the physician take appropriate steps at the time to profile the patient to see who is at a low profile or a medium or a high profile where the treatment would change.
Okay, but let's go back to blood pressure for a moment, because there, especially being Indian, I mean, there are a lot of natural, I don't want to call them medications, but natural ways for people to lower blood pressure without having to go to prescription drugs.
That is very, very, very true. The most important thing from a natural treatment standpoint of view would be the amount of salt you take. If on an average, if you consume more than 3 grams of sodium chloride, which is salt, there is a likelihood that that might affect your blood pressure. Weight, which is obesity. If you gain weight and if that is an issue that you're dealing with, you need to do something to improve the diet so that the diet will get modified and you can obtain a perfect normal height and weight ratio. And then exercise is another one. So, for example, if a person is inactive, that increases the chances of blood pressure being built up. And if that happens, the cholesterol being built up. And then diabetes also can happen due to inactivity. And the three combinedly can now lead to buildup of cholesterol in the areas of the heart or in the brain or elsewhere. So preventive medicine is the most important thing. So if your risk profile, meaning family history, high blood pressure, obesity or diabetes are present, then that would be the time to approach the physician, the family physician or the internist initially to recognize where your risk is. And based upon that, to do preventive medicine would be the most ideal thing. Number 1 would be salt. Number 2 would be diet. 3 would be exercise. If the first 2 things are not there, regular exercise will make a significant impact on your blood pressure, your cholesterol, your blood sugar, and then all of that will make an impact on coronary artery disease and buildup of the blockages.
Okay, I'm going to pierce some of the things that you said. I mean, they're all wonderful. I just want to know, though, why does it make a difference? Why does exercise? Now, we didn't even cover smoking, and we know about smoking. Yes. We don't even want to go there. But why does exercise and why does that, and weight, why does that make a difference?
As far as the weight is concerned, it does have an impact on blood pressure. Blood pressure has an impact on coronary artery disease, and even in the person who has coronary artery disease, the higher the blood pressure, the higher the risk of having a heart attack or heart failure or the combination of both. So even though one by itself did not directly impact, it has other ways of impacting. As far as the diet is concerned, that's what's most important. As far as blood pressure is concerned, taking lower amount of sodium, what exercise does is it produces some specific endorphins or specific changes in the hormones that will affect lowering of the cholesterol and improving the stamina of the person, which is the physical fitness. For example, if a person is quite inactive, meaning they just do the regular thing but not do any specific physical or cardiovascular exercise, and you have them go on a treadmill and look how quickly they will raise the blood pressure or show changes in electrocardiogram, showing blockages if they already have, and compare that to a person who has been regularly doing exercise, you would find a significant change in the person who has been doing exercise in favor of the patient as opposed to the other one against the patient. In other words, his blood pressure will go up too high too soon, necessitating you to stop the stress test, or you might see changes on the electrocardiogram that will give you clue to prematurely stop the stress test.
And so no matter how old the person is it too late for them to change their way of living to maybe reduce their blood pressure and their weight?
The answer is no. There is no age limit as long as they're physically capable of doing exercise. And people who have problems with lower limb having either by fracture or by deformity or other reasons, they can even do upper arm exercises, which are available in this country. So exercise, there is no limit of age as far as age is concerned, where you are limited from doing any kind of exercise.
It's interesting. I have a degree in gerontology, and I remember in our classes, they gave us cans of, just to show just what you're saying. You don't have to have actual weights. You can get cans of beans or cans of tomato sauce and just put them in and just go up and down. So you're watching television anyway. You just sit there, right? And you just do this. You don't have to do 100 at the moment first. But that's the kinds of things you're saying, isn't it? That if someone can't walk around, they still could do that. But let's just say that they can walk. Now, we hear about 10,000 steps. It's a lot of steps for an older adult if they haven't
Yes.
been doing it, isn't it?
Yes. The best exercise that the American College of Cardiology and the American Heart Association Task Force puts out is on a treadmill. Now, treadmill is not possible for everybody. And they recommend that you do at least minimum 40 minutes. That is, people are able to balance themselves on a treadmill, either holding onto the side rails or otherwise. If they can do that, slowly build your time up. Depending upon the height, you can increase the speed, but speed is not the issue. The time is more important than the speed is. For example, a 5'4" tall person would be an ideal speed of about 2.5 to 3 miles an hour, beginning at about 5 minutes initially, then the next day 6, 7, 8, 9, 10, and you increase it on a regular basis, and at least 5 days a week to a total of 40 minutes to 1 hour on a flat level exercise on a treadmill would be an ideal thing for all age group, provided they are stable on a treadmill. Now, if they are unstable on a treadmill, for example, they have problems with balancing or other reasons why they feel uncomfortable being on a treadmill machine because the belt is moving, the stationary bicycle would be an ideal thing. Now, some people would like to do other types of exercise, running, jogging. All of those things are good, but everybody may not be able to run, and it's outside, and the weather may have an impact, or if you are on a street, cars may pass by, so that might interrupt your ability to be consistent on a treadmill, which is possible. So that's the big difference.
Let me just tell everybody, you're listening to Dr. MAMMEN Zachariah, who is a cardiologist and internal medical physician, and he is at Broward Health Imperial Point, along with his brother, Dr. Zachariah, and his wife, Dr. Zachariah, right?
Yes.
I just wanted to ask you then, hearing about the exercise, my grandmother lived to be 95. My grandmother was overweight, and then my aunt lived to be 94. They did not exercise. So tell me how that comes about.
There is always a mystery in medicine. Even now, even though we feel on a regular basis we know more about medicine than what was 2 years ago, there are more to learn. There are so many mysteries that only God knows, and I have none. Nobody in medicine knows about those variables. That's an amazing thing. And I have seen patients who are even 100 years old who doesn't do any exercise, and they are just happy and they have no heart disease. So it amazes me as to how they do that. And so there is more to learn in medicine that we already know.
And I guess we now are gotten into stem cells and genes, and there must be something, and I'm happy about this because my Hungarian genes are working, right? But as you were saying, the best thing to do, because Dr. Mencia was just on the show, and he said, forget 100, we're going to live to 120. So let's say people like that with very good genes now are doing what you said, exercise and diet, and keeping their blood pressure down and not eating a lot of salt. And they could even live much longer and healthier, not just longer, but that they actually have they have a high quality of life, because that's really what you want as a physician, don't you, of your patients?
Yeah, that is very true. You give the examples of your family who have absolutely phenomenal gene. They are very few in number. If you look at the statistics and the population of the United States, how many people who have their physique will live to be that long? Extremely, extremely rare. And that is the reason why, when you look at the statistics, the number one killer in this country is coronary artery disease and heart attacks and death. That is the reason. And most Americans, most people who live in this country, if you look at their profiling, they fall into the category of people who do get coronary artery disease, blood pressure problems, and diabetes. And that is the reason why we look at them with a different attitude and a different eye.
Yeah, what you're saying is it's very important that that people do this. It's easy. It's funny. It's not like having to go out there and lift 100 pounds of bricks. All you're doing is just asking people to keep their weight in control. If they can't, there are plenty of places they can go to, Weight Watchers and other places. And I think even at Imperial Point now you have some sort of a program where people can join to
Yes.
watch their weight, don't you?
That is correct.
So that's good. I know they do a lot of things like that at Imperial Point. The other thing, though, I wanted to ask you is let's talk about salt. There's so much salt when people eat out or just if they get cans of things. It's amazing if you look on nutrition and you see about salt. So people shouldn't be salting their food.
That is exactly correct. Canned foods and processed foods have a lot more sodium chloride, even though they may not taste salty to your tongue. In order to be preserved well, the salt content usually is much higher. And then if you eat out of a restaurant, very rarely would people go there and say, okay, do not add salt, make it as little as possible, and I can add salt if I need at the table. So that's where, and I'm not blaming that the salt content is always from a restaurant. We eat salt, and when we eat at home too, some people like their foods to be more salted, and they add salt at the table. And that is how we tend to eat or get more salt in the diet.
Yeah, I don't salt anything, but some people, the way that they do this, they can't have salt, but they say that for their heart, eating hot foods, eating spicy foods is very good for their heart. Is that true?
Now, there has not been any literature or any evidence to show that that is true.
So that's, but I guess it just helps them with taste. But probably in those mixtures, there's salt in there.
That is correct.
So it's not just, but the most important thing is there are, and especially I keep going back to Indian cooking because you have wonderful spices that are not salt.
That is correct also.
Curcumin and
Yes.
And turmeric, and I use a lot of that, and cinnamon, and that really can take the place of salt.
That is true.
So I'm sure your wife knows all. Do you cook at home or does she cook at home?
I am a terrible cook. All I can do is make coffee in the morning and then microwave whatever I can.
But you eat well.
Yes, I do. My
But
wife
you're
is
very
excellent.
trim. Now, how do you stay trim like this?
I know I do not run around, but I walk a lot in the hospital from around 7 o'clock till about 9, 10 o'clock at night. So I keep just enough calories to burn so that I do not have to run on a treadmill and pay the penalty for it.
Well, you've just urged me for something because I walk my dog, but that's not the kind of walking you're talking about. And our condominium does have a treadmill, and I've yet to be on it, but you may have just rewarded me by coming here besides having a good show. I probably should do that. I have a lot of energy. I know I could manage the 40 minutes. I think I'm going to start doing that. Do I have to be aware of anything? I'm having a good balance. What do I do? Just start at 40 minutes?
No, I would first visit the physician and look at the cholesterol, the blood pressure, and see if any of those things are a little off the normal or the optimum reading for you. Then I would optimize that first. For example, if the blood pressure is normal, if the cholesterol is high, it does not prevent you from going on a treadmill, then you should be able to go on a treadmill. But if a person hasn't visited a physician and a treadmill exercise test has not been performed, if their age group and the profiling falls into the category where you need to do that, then I would urge everybody before they go on a treadmill to visit the physician, have them look at these numbers and make sure that the numbers are perfectly optimal for them to go on a treadmill.
And they can probably start with less than 40 minutes, too.
Yes, they always
can start
start
5 minutes and just see how that goes. And
that is right. Just flat on the ground without an incline, and then try that. But if you haven't had any examination by a physician, then I would encourage, if they are young people like 30, 40 years of age, I don't see a reason except the blood pressure needs to be looked at. Otherwise, I would encourage them to meet with a physician to confirm that they are safe on a treadmill.
now you're working at the hospital, so do you actually have a private practice?
Yes, I do. My wife Molly, my brother Zachariah, and I practice cardiology. My wife practices clinical cardiology, which is doing stress tests, echocardiograms, and the regular type of cardiology. And I do the same thing, in addition to which my brother and I do interventional cardiology, where we do cardiac catheterization and coronary artery stenting and all of that.
All right, and how would they contact you?
Our main number is 954-772-2200, and you can ask for any of the Zacharias.
Okay, well, that's good. 954-772-2200. Do you have a website at all?
Yes, I think Broward Health has
the Broward Health
yes.
has it. Yes,
Yeah.
yes, we can get on there. Okay, so now let's just keep talking about this. Now, as a cardiologist, are you, and of course you are a specialist in cardiology, but you're also internal medicine. So you have patients who come to you because years and years ago, I went to an internist who was a cardiologist. And I will tell you a funny story about it, thinking about it. I was very much into supplements many, many years ago, and he wasn't. And I'm talking probably about, it could be 35, 40 years ago. And he and I was taking vitamin C and some of the others. Oh, he says, don't worry about that. It's nothing. You don't have to do that. But I think people have come around now where it's good to take certain supplements.
That is partly true. And from a cardiology standpoint, the most important basic requirement would be, based upon the age group, a baby aspirin 81 milligram and a multivitamin, which has most of the supplements in the minimum requirement you need. In this country, as affluent as we are, as far as diet is concerned, almost nobody lacks the most important chemicals or the elements that are required. There are some patients who, when they visit the physician and they look at their, there is a new test, it's fairly new, it's called CRP, or C-reactive protein, which is a marker of the inflammatory process in your body. There are two types of CRPs. One is high-sensitive CRP, which is specific for the heart, and then the CRP, which is of a general concern. If those things are elevated, then the physician might recommend the use of folic acid or even a statin, which is a cholesterol-lowering drug, which work in favor of being an anti-inflammatory drug. So if you were to break it down, the newest guidelines would recommend baby aspirin, a statin drug if necessary, folic acid if the CRP are high, and then regular exercise. Those are the minimum for most people, and that can bring most everybody's risk to a much lower level than if they are on a higher profile.
I was very privileged to know a wonderful doctor, unfortunately, who just passed away, who was here in Broward County, and we talked a little bit about the heart, and even though he wasn't a cardiologist, and he said, well, why don't you take magnesium? I think it's a very good thing for you to do. And I've been taking it, and it has really lowered my blood pressure, which is amazing.
That is very true, because there are very rare conditions, like, for example, patients who are pregnant and become severely hypertensive. One of the drugs that we give intravenously is magnesium. That still works. Magnesium affects the patient's potassium level, meaning favorably. There are patients who lose potassium in the kidney, and when potassium goes down, it can favorably raise the blood pressure in some patients. And therefore, by giving magnesium, it will replenish the potassium, which was an initial reason why the blood pressure could have been raised. I'm not saying everybody who has high blood pressure should simply take magnesium and think the potassium is going to change it. But if that is true, that may be the most reasonable way of explaining why magnesium would help lower the blood pressure.
You know, we're going to run out of time, but I did want to tell you this, that talking about my grandmother, of course, my grandmother, many years, they lived in New York, and she would climb up 6 stories. You see, years ago, people didn't have elevators.
Yes.
And so it was a walk up, and she went up, and maybe all those years of carrying her bundles up and all the children, maybe that did a good job for her, huh?
Absolutely. I think she was made of steel, because at that age, to go up 6 flights without...
No, not at that age. This was much younger. I mean, no, after she retired and came to Miami Beach. But you see, Miami Beach was good for her. But for years, when people were younger, people walked up. We didn't have elevators.
Yes.
We didn't have air conditioning.
Yeah,
it's amazing, isn't it?
The lifestyle has changed so much.
So many things I wanted to ask you, and we've run out of time. But Dr. Zachariah, it's just been wonderful. I'm so glad that you came, and we didn't let your wife talk. She didn't want to talk, but we had her talk on her radio, so we'll have to book her another time. But thank you very much for coming and being here with us.
Thank you so much for having me. It's been a pleasure and a privilege to be here and to talk to you and be of some help.
Yes, you're a big
community.
help. Our listeners really love our shows, and we've been doing this for almost 30 years, so they're used to very, very smart people. Thanks very much.
Thank you so much.
Bye.